guys. I'm Dr. Teo Wan Lin, and welcome to my podcast, Dermatologist Talks Science of Beauty. In this podcast, we discuss all things beauty and science related, including what's new and trending. Well, just a couple of weeks back, celebrity J.Lo caused a bit of a stir amongst a few dermatologists in the US when she claimed she hasn't had Botox till this day, crediting her 51-year-old wrinkle-less visage to olive oil, notwithstanding her latest skincare line launch. Now, I definitely have my own opinions on that, both as a woman and as a dermatologist. But before you hear what I have to say, I want to introduce three guests, plastic surgeons and friends of mine, Dr. Chris Chui, Dr. Terence and Dr. Rasheed from AZATACA Plastic Surgery, who will be joining us today on this episode. I had the pleasure of working with Chris, Terence, and Zul, who were my registrars when I was a junior dermatology resident and rotating through the Department of Plastic Surgery and Burns Unit at the Singapore General Hospital over a decade ago. How time flies. They have now set up their private practice, AZATACA, and are also my neighbors at Royal Square Novena Medical Suites. So big hello to you guys. It's been a really long time. How has 2020 been for all of you?
Hi, Wan Lin. This is Chris. Yeah, thanks for having us on your podcast. My interest is a lot of mostly reconstructive surgery, some aesthetic work as well. In Singapore, we do a bit of everything. 2020, same for everyone. We've had our ups and downs, but overall, we've pulled through quite well. AZATACA is doing well, so it's good to be your neighbor as well. Hopefully, we'll see you around.
It's lovely to have you guys in the same building again. And Terence, tell us what you've been up to.
Hi, Wan Lin. Thanks for having us on this podcast. This is my first time, so it's quite exciting. AZATACA is formed by Chris, myself, and Zul, so we are three plastic surgeons together. We had, like Chris mentioned, a rough time in the earlier part of the year, but we managed to pull through. So now we have just relocated to the new AZATACA Plastic Surgery Center on level 14. So we're looking forward to this new place that we have, and also meeting you along the corridor.
Well, excellent, and likewise. And finally, we have the third musketeer, Zul.
Hi, Wan Lin. How are you? Can't believe that it's been 10 years since we met in SGH. I'm Zul. I'm also a plastic surgeon in AZATACA Plastic Surgery. My interests are in breast and body contouring. And 2020 has been quite an exciting year, and we're all waiting for phase 3 to come about.
Well, it's so great to connect with you guys again. So moving on, before this podcast, we were each tasked to examine the video featuring J.Lo in her latest skincare line advertisement, where she shows off her flawless face and body. And that apparently inflamed a few US dermatologists who claimed her Botox denial was particularly galling because she was showing off her superior genes and quote-unquote zero-effort beauty, and suggesting perhaps she was dismissing self-care and the discipline it takes to achieve beauty at her age. Personally speaking, I was slightly surprised at the outrage because while it isn't common for a 51-year-old to look as flawless as she does in the video, and even less common for someone who has never had cosmetic treatments, as a dermatologist, I am generally quite cautious about passing my own judgments about someone's appearance, their age, regardless of what they've done or not. But it's also quite relevant that we bring up the issue of whether her statements of Botox denial may have been offensive in any way, and would it have been different if she had just credited her healthy lifestyle habits instead of her skincare routine. Well, more on that later because I want to hear what my colleagues in plastic surgery have to say. Now, first up, what do you guys think? Is it at all possible that J.Lo hasn't had Botox?
So I'll go first, as Chris here. So yeah, at 50 years old, she looks really good. She looks quite amazing, actually. Her body as well, as you were saying. But I mean, it is. I guess it is possible, but it's quite highly unlikely. I mean, in the circles that she's running in, everyone around her would be having some type of treatments done. It's highly likely that she did something along the way. I'm not sure why she would say hasn't done anything, especially Botox, which is quite harmless. But I mean, it could have something to do with the fact that she's launching her own skincare range. But I guess we'll give her the benefit of the doubt and believe her. But yeah, it's pretty hard to get to that age and not have anything done and look so good.
Yeah, I think it is like you mentioned, it's rare to look so good at this age without any wrinkles. I did go online to look at some of the other photos. As a celebrity, there are tons of photos. So some of the photos you can see she does have some under eye wrinkles, and then also some crow's feet as well as some smile lines. So I think that was a video. It could have been there could be a lot of makeup. There could be use of filters. So a lot of these technologies that are so readily available, which I'm sure she has, like a good makeup artist, you could conceal quite a fair bit, So I mean, I think she definitely used some of that to advantage. But yeah, like Chris mentioned, I think it would be quite rare if she hadn't tried any of it before, and certainly it would be advantageous for her to try to seem like she did it naturally or through her own means, right? Yeah.
I think it certainly is possible that she hasn't had the treatments like Botox and stuff, but it is like what the rest think. It's quite probable that she has had it, and I don't think that's there's any harm in in admitting that you've had something like that. But yeah, there may be factors like her upcoming skincare range, which she's trying to promote, which is making her hide the fact that she might have some Botox.
Yeah, so all that is very relevant, and I do see where everyone is coming from. I have to disclose that prior to this podcast, I had privately polled another plastic surgeon who thought it was definitely possible that she hasn't had Botox and simply had amazing genes, a healthy lifestyle, and the hairstyle that she was wearing in the video certainly, created an illusion of perhaps a more youthful, tighter, and lifted facial appearance. What do you think are the chances of that?
Well, maybe she hasn't had Botox, but maybe she has done other things other than Botox, Altera. I think she also said that she hasn't done any fillers at all. Or any injectables, but maybe some other things like HIFU, some RF treatments. I don't know. But healthy lifestyle would definitely help. Getting enough sleep, looking after your skin. I think she said she used sunscreen. That was the one thing that she definitely said that everyone should be using. But yeah, I mean, it's hard to say whether she really has or hasn't. But most people at that age would look quite a bit older if they haven't had anything done.
My personal assessment is that it's pretty interesting. All of her skin, including her body skin, looks pretty homogeneous with the facial skin, and we know that it is not easy to change the quality of skin. Botox doesn't directly prevent photoaging, and while it can stimulate collagen production, on top of relaxing facial muscles, they're responsible for deep wrinkle formation. An objective assessment of aging that dermatologists use is the Glogau photoaging scale. So that incorporates many other observations such as skin elasticity, texture, pore prominence, pigmentation, and skin radiance. And, she also seems to have a really good facial bone structure, which I think helps an individual to age well too. And I think plastic surgeons are the experts on facial bone structure. So what do you guys think about that?
Yeah, I mean, her bone structure definitely helps her because, she's got high cheekbones. Like Chris mentioned, she could have done other things that tighten the skin, including stuff like skin boosters and maybe even fat grafting. So there are quite a few other tricks that she could have done. But certainly most of the time when patients have done some of these things, they would have already started with Botox or fillers, because Botox and fillers are, after all, the most common and most readily accessible treatments. They're also probably, one of the least invasive ones. So most people will actually start with something along those lines. So I mean, we'll never know if she ever did.
Personally speaking, I have definitely met patients who had unfortunately very photo-aged skin, and they also had deep wrinkles. Now, of course, when you administer Botox, then they're no longer able to use their facial muscles in that period of time, and you'll find that the lines become less deep, but then it doesn't change the fact that their skin is photo-aged. And in terms of the skin on the body as well, don't you think that's an important clue?
So basically, you're saying that there's a good correlation between the facial skin and the body skin, right?
I mean, we can't really change the skin aging process on the body very convincingly.
That's right. So your observation that, she's got good body skin also suggests that, there may be, a good genetic component. She's really taking care of her skin, her diet, the fact that she's not smoking, which also contributes to it. So yeah, it may certainly be possible that, she hadn't had treatments like Botox.
I think at the end of the day, what I am really interested in is how these dermatologists are pretty convinced that there is, absolutely nothing other than Botox, which she must have had, in order to account for her current appearance, or at least, kind of single-mindedly advocating, such cosmetic interventions as part of, looking good, perhaps in her age group. What Zul mentioned actually is consistent with emerging research in dermatology. We call it the skin exposome concept, which essentially defines lifestyle factors in addition to genetics that play a key role in inflammaging. Inflammaging is a process that has been well defined in cell, animal, and clinical studies affecting our body systems. As dermatologists who treat all skin conditions topically, in addition to systemic therapy as well, where it's warranted, we're talking about, cosmetic issues of the skin right now. And clearly the skin is also able, likewise to absorb active ingredients, just like it does when we apply prescription medications. The science behind free radical fighting antioxidants in skincare, for example, is well able to substantiate slower photoaging onset in an individual who is firstly, leading a healthy lifestyle, having a good skincare routine, and in her case, very likely there is an element of, good genes as well. In terms of lifestyle, nutraceutical interventions, an antioxidant-rich diet has been shown in geriatric patients to improve both physical and psychosocial wellness. In terms of exercise, high-intensity interval exercise has demonstrated that on a cellular level, it stimulates fibroblast production of collagen. Well, for our international listeners, it's interesting that just a couple of years back, the internet was awash with news of Singapore's very own ageless specimen, Chuan Do, a model turned photographer who is in his 50s and still looks like he is in his 20s. He's credited his disciplined diet and exercise regime, but I think regardless of whether he had any cosmetic treatments, it just wasn't something anyone was talking about at that time other than, wow, he is 50 and looks this good. So I figured there are maybe a couple of issues here which I really want to hear what Chris, Zul, and Terence have to say. Are dermatologists and plastic surgeons in Asia who work with skin of color more convinced about the role that melanin has to play in the photoaging process?
I'm not sure about melanin, but definitely, it does afford some sun protection against the UV radiation. And as our population here in Singapore, we generally do have thicker skin. We don't age as badly as the Caucasians do in the West. So I suppose someone like Chwando, he is it is, we see him. Definitely his face, he looks youngish, but he definitely can pass for someone about 25, 30. But I guess it's not uncommon to see someone for Asians to look young. Even amongst the three of us, our patients always tell us we look young, like Terence and Zul. They both have baby faces as well. But Chwando's body is really amazing for 50. And that is definitely not surgically done. It's all his own hard work and exercise. But yeah, I guess in general, the Asian population does age a lot better than the Caucasian population.
Yes, so you mentioned something quite pertinent, which is the baby face phenomenon. And it's something we talk about in dermatology as well, as one of the key determinants of how well someone ages. That is just plain genetics. What do you think, Terence?
We do age a bit differently. And if you look at his skin, he's actually very fair. So I guess he definitely puts a lot of care into sun protection. He leads a really healthy lifestyle. His body's really ripped. Probably doesn't smoke. So I think all that helps. Probably has very good genes. So I think all that kind of is to his advantage.
There are certain characteristics that can be directly applied to skin of color, which enables it to retain more perceived dermal elasticity. So the fullness of the dermis and the fact that skin of color inherently possesses more photoprotective melanin, which translates into less photo damage compared to, a counterpart of the same chronological age. Like J.Lo, she is considered someone of color. And we know that the increased melanin content in our skin enables us to tolerate UV damage a lot more than our Caucasian counterparts, individuals of Fitzpatrick phototypes 1 and 2. And clearly, because at least in this part of the world, we do require it because, we're right at the equator and we get 100% of the UV rays all year round. Although our cumulative, lifetime sun exposure still does depend on our lifestyle. Do you think, Zul, since we work in Asia and our patients predominantly belong to the skin of color category, that there really is a difference in terms of how we age and how we respond to cosmetic treatments?
Yeah, so I've had the chance to work in Europe during my fellowship and, work with Caucasian patients, and back in Singapore where we predominantly work with Asian patients. So I get to compare between the Asian skin as well as Caucasian skin. I do feel that Caucasian skin is thinner, and in terms compared to Asian skin, they age much faster than us Asians. At say 30s, Asians still look young, whereas Caucasians might look a little bit older already by then. They tend to develop wrinkles much more easily, and over sun-exposed areas, such as the décolletage as well, so compared to Asians. It affects us as plastic surgeons surgically because, when you make an incision in a Caucasian patient, they heal pretty well when you close it, but not so easy in Asian patients, and you've got to have very good tissue handling techniques as well.
I find that there is definitely a difference between Asian and Caucasian skin types in terms of how they tolerate cosmetic interventions as well. Specifically, lasers. So both ablative and non-ablative lasers require lower energy settings in skin of color. For skin rejuvenation, skin resurfacing, and also for hair removal. And that's because we're much more prone to developing post-inflammation hyperpigmentation. So the settings which are used for Caucasian patients won't be applicable in skin of color. And why should Botox or any other cosmetic treatment denial be offensive? Let's say she really didn't have Botox. What's wrong with saying that? I mean, unless those dermatologists who came out to comment were her dermatologists, in which case it's just J.Lo lying, and I frankly don't think that's the case.
Well, I mean, we have to respect the J.Lo as a patient, and we do respect patients' confidentiality, so she can say whatever she wants, and we can't say, her dermatologist can't say that she's had Botox or she hasn't had Botox, because that'd be revealing something. So it is her right, but whether, as a celebrity she should be saying that, I'm not too sure about it.
Exactly as what you said, I did feel slightly uncomfortable because at the end of the day, an individual has a right to honestly say what they want to say, and if it's false, it's on them. But as physicians, especially when there may be a commercial conflict of interest, so in this case, we are the administrators of such cosmetic interventions, to actually comment and pass a judgment on that. Well, the fact that she is a public figure, I guess you do have to be held more accountable to what you say, because lots of women and men may be following you as a role model. And what is the message that you're trying to send here? I mean, trying to scrutinize what, is behind her message of Botox denial. Terence, do you think that there is something she's trying to achieve here? Or is just something that only very sensitive individuals, say as doctors, who have an interest in recommending Botox to patients, versus the lay person, right? Or to the public, her fans, who may not give a second thought to what she's saying, because what she's saying is not exactly, something heinous.
Well, I think I can understand where she's coming from. If she's an individual that has always been trying to promote, being natural, and not having gone under, treatments like Botox or fillers, then certainly, this is something that will be damaging to her reputation and her image, and of course, like, she has commercial interests. So I can see where that's coming from. However, what I don't get is I don't get why the doctors who may or may not be her doctors, I don't think they are. Why are they so riled up about her denying it? Because lots of people deny having done stuff, even surgery. So life goes on, right?
I mean, I think if she really is telling the truth that she never had Botox, then she's doesn't really have any angle. She's just relaying a anecdote that she's never had any of these treatments. That's all. But if she really did have, and then she's just denying it for the sake of her business, I mean, maybe that's her prerogative to promote her business. But in terms of getting offended, I mean, I guess some people just believe that everyone should be honest and you shouldn't have anything to hide, even if you do have these treatments done. So they're just trying to say that if you have had it done, it's okay. You don't have to hide these things. But even J.Lo, when she did say that she didn't have Botox, she just said that, it's just she's not that type of person, and then she just hadn't had it done. She said there's nothing wrong with it, and there's no reason to hide it. But she was just relating that she hasn't had it done before. So yeah, I guess we'll never know.
I mean, don't get me wrong, because I do perform cosmetic dermatology interventions like Botox and fillers, but I always let the patients point out to me what they see, what they want to improve on, rather than pointing it out to them, right, myself, or even suggesting it. Like you said, a holistic approach emphasizing the overall health of the body is also very important to retard the processes involved in aging and inflammation. It is my personal opinion that you can still look good with wrinkles. And as long as it doesn't bother you, no one has the right to comment on that. The converse is also true. I mean, if you don't want to have wrinkles, we are here to help you. Above all, I think what you spoke about, Chris, is something that's resonating with me deeply because there's enough insecurity going on, in our realm of practice, both in dermatology and plastic surgery, that we know that at the heart of it, our work is about alleviating the patient's distress. So whether it's, physical medical condition that's causing them pain or discomfort, or in the case of a cosmetic concern, they are equally distressed psychosocially. The focus at the end of the day is still on helping the patient. I want to close with some of my personal thoughts on aging, first as a dermatologist and secondly as a woman. 95% of my patients belong to the skin of color demographic, and I think that the science does support melanin being photoprotective and that it does slow down photoaging in pigmented individuals. I personally think that it is never 100% possible to tell if someone has had Botox because ideal injection techniques result in a very subtle and natural appearance.
No, definitely. Nowadays, with the surgical techniques as well as injection techniques, it's the goal is actually to create a natural type of beauty without the telltale signs of any sort of procedures being done. So it can be very difficult to tell if anyone's had anything done, even surgery, unless you really take a close-up look at them and can see the scars. But if it's very well done, then you may not even be able to see the scars. So yes, it's very hard to tell.
And to say the converse, that you are sure someone has had Botox when they are of a certain age and look that good, is dismissing a lot of evidence that is emerging in this skin exposome concept in dermatological research, which defines lifestyle factors in addition to genetics that play a key role in inflammaging. In the case of Chuan Do, who has this amazing sculpted body which surgery can't achieve, and clearly, my personal opinion is that if we are being pressured to look good, and to feel that we are only going to be the best version of ourselves by the advertising that's going on with cosmetic treatments, this isn't a very sustainable nor healthy scenario in the medium to long term. And for doctors to come out to say that it's almost a given that if anyone wants to look good in the eyes of the world, you have to have aesthetic treatments. I think at the end of the day, we have a right, to decide what looks good to us and not to feel that we have to live up to the expectations of others, or, worse still, it is very unhealthy for us to be comparing ourselves to other people. And on that note, we also know that self-criticism is a real factor, in psychopathology, increases the risk of many psychological conditions. The thing I do find shocking is why should it be that it is seen as, as someone boasting about their superior genetics if they deny Botox. Why is it the first thought that comes to your mind when someone says they haven't had Botox? Is Botox so ingrained in our society now that in order to look good at 51, you must have had Botox? You and I, we practice these aesthetic interventions, and we clearly take a different approach in terms of how we explain these treatments to patients. And, as plastic surgeons, your core is still in reconstructive surgery. And, not to downplay the value of, restoring one's appearance, right? So when you say perform reconstructive surgery in an individual who's had tissue loss due to cancer or, an atypical infection, you can see how it really helps them in terms of their self-esteem and daily functioning. We know that appearances are important, but to the extent that when you are a healthy individual and when you are talking about looking good at 50, looking good in the eyes of the world, then you must have had Botox. And if not, then you are boasting to the world about your superior genes or lying. I just find that it's slightly difficult for me to comprehend and to accept that.
I definitely think that there are a lot of people with naturally good skin, like I wouldn't say superior, but they just have genetics that helps. Certainly their lifestyle and diet also helps, so I think that's probably the more important thing. Things like sunscreen, not smoking, exercising. And I do see many patients that don't age as much as someone else, so I think that certainly plays a big part. So maybe the people who are upset, they're envious. I'm not sure, but I definitely think it's not all that impossible, not all that far fetched, to have good skin without having to do a lot.
Do you think that with the popularity of aesthetic treatments, especially when they are, being practiced by non-specialists, so non-dermatologists, non-plastic surgeons, it is, creeping into the public perception that these treatments are normalized and you must have some of it in order to look good, whatever age you are at?
I guess with social media, aesthetic treatments have sort of become the cultural norm that, you must have it, in order for you to look good. But personally, I don't think that's the case. I think what's paramount is a healthy lifestyle. Good genes is helpful, but a healthy lifestyle, eating well, exercising, not smoking, no late nights, sleeping well, that is paramount, in helping a person to look as best as he or she could possibly can.
We've already spoken about the lifestyle factors being evidence-based, in terms of the research that we have now. The disruption of the circadian rhythm has been shown to accelerate aging in cell and animal models. Just by experience, you and I know that if you are lacking sleep or when we are doing night calls, we find ourselves really fatigued and our immune system is also down. So what you've said, Zul, is very important in terms of shaping our societal views on aging. Increasingly, we know that we ought to be more sensitive about age and people growing older because being discriminatory, like if you see an individual who is showing the physical signs of age, and we can clearly communicate that objectively in a medical way, but is it actually appropriate for us to, very brashly communicate that and convey that to the layperson, to the public as well? And if it does lead to some form of ageism in terms of a discriminatory attitude?
I think there would be some ageism in society. Based on looks. I mean, everyone wants to look good and that better looking people, get promoted faster, they earn more money, in the corporate world, things like that. So there is definitely some discrimination against people who don't look as good. I'm not sure whether it's ageism or not. but I suppose younger people in general tend to look better. But yeah, there definitely is something, and I guess that's why people do go for these treatments, to look younger and to look better, to sort of help with their personal and professional life as well.
There is absolutely nothing wrong with that. And in fact, a way to look at that issue is really in terms of how you put yourself together. Because for that same reason, we dress well. It's a measure of conveying respect to the other party. And when you look like you take care of yourself, our hope is sincerely that you are really taking care of yourself. And none of us here would be advocating an intervention where you're simply just doing the cosmetic treatment and having a very unhealthy lifestyle, heavy smoking, alcohol consumption, and a sedentary lifestyle. But I feel as doctors, as medical professionals first, the public innately holds us in a certain regard in terms of how they do respect what we say. I mean, hopefully. Perhaps 8 or 9 years ago, I would have been really convinced that you do have to look your part. You have to look good, which would offer you certain advantages in life and in general. But it's a matter of to whom you're trying to sell your attractiveness to. Because the same people who may be evaluating you based on your attractiveness are maybe not the kind of people who would stick with you in the long run. Do you know what I mean? So if your employer is hiring you just because of your good looks or thinks that you can get an edge over somebody else because of your better looks, I'm not sure if that's going to be sustainable, because there's always going to be someone who's better in terms of that. And obviously you're totally incompetent as well, no matter how pretty or good looking you are. I think that's a real problem.
Yes, I agree. I mean, our philosophy has always been, we want to put the want you to have the best version of yourself. It doesn't necessarily have to be through some form of surgery and all that. Definitely it's more important to be truly who you are, and like you say, it really depends on who you think your audience is, right? So I think cosmetic dermatology or cosmetic surgery or plastic surgery, it's not going to land you that job. It's not going to get you that promotion or get you that boyfriend. So you do it for the reasons that you want to do it, but you should not have inflated expectations of what these treatments do for you.
A condition known as body dysmorphic disorder is pretty common in aesthetic patients. And I'm sure in plastic surgery, as it is in aesthetic dermatology, you would have experienced these profile of patients who have an underlying psychological disorder, which incites them to go for countless cosmetic interventions, and this is very often associated with a high patient dissatisfaction rate with the physician, and of course in terms of their appearance.
Yes, I've had patients encountered patients with body dysmorphic disorder, patients who've had aesthetic treatments like fillers, who then had it removed a few days later and gone somewhere else and had fillers again and then had it removed because they're not satisfied with what they have. And there's an element of depression in this, so we've got to really pick it up.
It's so saddening, I feel, that we have to get to this point where doctors, whom the public look up to traditionally as healers, sometimes have to make this kind of judgment simply because the practice of aesthetic medicine is fairly new. I don't know about you, but I personally feel that a lot of the narcissistic displays we see on social media, and it's also without a doubt, borne out by ongoing epidemiological studies as well, that narcissism, now not in terms of pathological narcissism, but just narcissistic traits in general, are on the rise internationally. I think there could be some sort of correlation with the rise of aesthetic medicine. It's a cycle. The beauty industry, which is now also intertwined with medicine, provides an avenue for improving your appearance and then sells this idea to you that you can be better looking and or younger looking, and it will offer you these advantages simply because you look better, that fuels narcissistic traits.
Yeah, well, so you do have to be a little bit careful, like you say, like these patients, I mean, just people in general, they just want to keep looking better and better, but sometimes there's a limit to how much you can do. So we do have to be careful and tell them, okay, look, I think you've had enough. Sometimes, we shouldn't do any more. But there are some unethical doctors out there who just keep giving fillers, even if the patient their face is very full already and they don't really need any more. Also, not just doctors, but in other countries, or even in Singapore, beauticians are still carrying out these treatments in their own houses or hotel rooms, things like that. So, and these practitioners are not bound by any ethical obligation. They're just bound by commercial interests. And so they'll just keep giving you as much as they can sell. So it is very dangerous. And it is true that social media is feeding this type of behavior, in general. Yeah.
Well, at the end of the day, we still don't know if J.Lo was lying or not. But to be offended that cosmetic interventions like Botox are being specifically denied by celebrities, even if they are telling the truth. What's the deal with that? Why should it be seen as them boasting about their superior genetics or even crediting their skincare regimen? Now, I feel my underlying discomfort is really that we are being pressured to look good and to feel like we are only going to be the best version of ourselves by the advertising that's going on with cosmetic treatments. By the way, there's absolutely nothing wrong with cosmetic treatments, and myself, I perform these for my patients. But the key here is that I'm not the one suggesting it to my patients. I'm not sure how many dermatologists actually practice this way, but I feel that when it comes to cosmetic dermatology, it has to take a slightly different approach as compared to medical dermatology, where we are, definitely leading the conversation with regards to a diagnostic sort of, aim to come to a diagnosis. But in cosmetic dermatology, these, pathologies are actually not life-threatening, although they may cause some degree of psychosocial distress. However, this varies. So an individual may not be bothered by wrinkles, whereas another person may be. One person may be bothered by their pigmentation, but not by their wrinkles. So the key here is, I feel it's slightly disturbing if it is going to be that doctors are coming out to say that it is almost a given for anyone who wants to look good in the eyes of the world that you need to have cosmetic treatments. Well, that's it for today's podcast episode. Thank you, Chris, Terence, and Zul for coming on board with your expertise and personal thoughts on the practice of aesthetic medicine. You may follow them on Instagram at AZATACA Plastic Surgery. We hope you enjoyed this podcast. Merry Christmas until the next episode.
Thanks, Wan Lin. It's been great chatting with you about all these things. Hope to do it again someday.
Thanks, Wan Lin. This is my first time. It's quite fun. Look forward to seeing you along the corridor. And Merry Christmas, everyone.
Thanks, Wan Lin. It's been a pleasure talking to you on your podcast and to all your viewers.
All right. Thank you all and have a Merry Christmas, everyone.